havoc on the CAP's response. Health workers are under attack in a number of locations due to rumors that they are purposely spreading the disease. And response efforts in many places have had to be suspended because of concerns around violence. Pharmaceutical companies are being accused of introducing the CAPS virus so they can make money on drugs and vaccines, and have seen public faith in their products plummet. Unrest due to false rumors and divisive messaging is rising and is exacerbating spread of the disease as levels of trust fall and people stop cooperating with response efforts. This is a massive problem, one that threatens governments and trusted institutions. National governments are considering or have already implemented a range of interventions to combat misinformation. Some governments have taken control of national access to the internet. Others are censoring websites and social media content. And a small number have shut down internet access completely to prevent the spread of misinformation.
Over the internet. In some cases, limited internet shutdowns are being implemented to quell panic.
How much control of information should there be, and by whom? And how can false information be effectively challenged? And what if that false information is coming from companies or from governments?
We're at a moment where the social media platforms have to step forward and recognize the moment to assert that they're a technology platform and not a broadcaster is over. They in fact have to be a participant in broadcasting accurate information and partnering with the scientific and health communities to counterweight, if not flood the zone of accurate information, because to try to put the genie back in the bottle of the misinformation and disinformation is nigh impossible.
One thing we haven't spoken about, and I'm wondering whether it's time to talk about this, is a step up from the part of the government on enforcement actions against fake news.
My team has been monitoring the public response, and on various social media channels and cable networks, there's been some conspiracy theories that are around about the potential that pharmaceutical companies or the UN have released this for their own benefit. So as we move forward, obviously trust in pharmaceuticals and government is very important at this moment. And so as we move forward with developing the right scenarios, we have to make sure that the public communication is a major part of that because of these issues.
Which is SARS, the causative agent of severe acute respiratory syndrome. And listen to this. The original SARS patent expired today because they didn't pay for the maintenance fee. So instead of keeping up with the maintenance fee, they just released a new virus. And you'll see in a couple minutes why this is so special. If you want to look at the actual patent, blah, 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 blah. Signees, United States of America, the same abstract, newly isolated human coronavirus, SARS causative agent. And it says right here, this invention was made by the CDC and is owned by the U.S. government.